go through this a little slowly, a little bit slower today than what you'll normally be doing it when you get up to full speed, just so that you guys can get some notes and kind of see what's going on. And better at this point to kind of watch the demonstration and watch what we're doing so you get the technique rather than kind of trying to scribble this all down. You're going to have the next couple of hours that we're all going to be coming around and working with you, helping you practice, and at that point you have questions about anything that you didn't get, we'll help you so that you can, like write things down then. So, okay. All right. So to begin your physical assessment, I would enter the room. First thing I would do is wash my hands. I just Purelled right now since I don't have a sink right here. And I would start my physical exam by stating the 4 assumptions. Okay, so the 4 assumptions that you're going to make about your patient are that their vital signs have been checked and they're all within normal limits. The next thing is that your patient is in no acute distress and is alert and oriented times 3. You could say A&O times 3, and that's to person, time, and place. And then the final thing you're going to say about your patient is that visual acuity, a test of cranial nerve 2, the optic nerve, has been assessed by the Snellen chart. Okay? So I would enter the room, introduce myself. Hi, my name's Lisanne. I'm a nursing student. I'm going to be doing your physical assessment today. So as I begin, as I'm shaking her hand there, that gives me a nice opportunity to begin my assessment of the skin. And I'm going to be assessing her skin throughout the entire exam and doing this bilaterally on both arms. Okay? So I'm looking at her skin, I'm checking for any abnormal rashes, any lesions or nevi. I'm looking at hair distribution, noting any abnormal patterns. I'm feeling with the dorsum of my hand for temperature, also checking the texture of her skin, the moisture. I'm going to be looking for turgor and mobility, okay, making sure that there's no excessive tenting and that her skin is elastic. Sometimes in your older patients you're going to see a little bit of tenting, but really we're just looking to make sure that they're well hydrated. Okay, moving down, I'm going to be looking at her fingernails. I'm going to be checking for any clubbing or any pitting of the nails, and then checking capillary refill time. I'm just going to be giving a little press on her nails and watching that color comes back in less than 3 seconds. As you can see, Shannon has on nail polish. Some of your patients might. It can be a little tougher to assess, but you can kind of just look at the base of the nail. Okay, and I'll be doing this bilaterally on both sides. Next, I'm going to begin with the inspection of her head. First, I'm just going to be noting the contour, the size, and shape of her head. Is it okay if I touch her head? And I'm going to begin by palpating, just feeling around, making sure there's no lumps, bumps, or abnormalities. Do you have any pain or tenderness when I do that? Okay. And I can part her hair, taking a look at her scalp, making sure there's no excessive dryness, any spots of alopecia, dandruff, checking for hair distribution, and also for any pest inhabitants. Okay. And at this point, I can now state that my patient is NCAT, and that stands for normocephalic and atraumatic. Okay. And some of these things are written back there on the board for you guys that you can take a look at afterwards. Okay. So moving on to the face, I'm going to first inspect. I'm going to see that her eyebrows are both present and symmetrical. I'm going to notice that her nasal labial folds are also both present and symmetrical. That the lateral canthus, or also called the palpebral fissures of the eyes, are in line with helices of the ears, and that her nose is midline, and that there's no deviated septum present. Okay? And now to check begin with the cranial nerves. We'll start with cranial nerve 7, the facial nerve. I'm going to ask my patient, could you smile for me? Okay, frown, and puff out your cheeks. Good. Can you raise your eyebrows for me? Now close your eyes, and I want you to resist me opening. Okay, good. You can open your eyes. Next, moving on to cranial nerve 5, the trigeminal nerve. I'm going to be assessing 2 portions. First, the sensory portion, and then the motor portion. All right, I'm going to ask you to just close your eyes for me, and when you feel my cotton ball touch your face, just tell me when you feel it, okay? Pardon me.
No, 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 no.
Good, you can open your eyes. Okay, and then for the motor portion of the trigeminal nerve, I'm going to ask you to clench your teeth for me. And I'm feeling that both the temporalis and the masseter muscles are engaged. Okay, good. And now could you open and close your mouth for me? Perfect. And at this time, I'm palpating the temporomandibular joint, the TMJ. Do you have any pain or tenderness there? Okay, good. And I'm also noting any popping or crepitus. At this point, I can also feel her temporal arteries here. Okay. And I'd be noting that they're normal, no indurations, and I would grade those at a 2+. All right. So moving on to eyes, I'm going to begin, at this point I would want to say that my patient is with normocephalic and atraumatic. I already said that, never mind, excuse me. I'm gonna move on to the eyes like I originally said. I'm gonna start by inspecting first her lids. I'm gonna note that her lashes come up and out and down and out appropriately. I'm noticing the sclera is white as it should be, that the corneas are clear. I'm noting that her conjunctiva is pink and moist or clear and moist, as Dr. Desjardins has told you, and that her pupils are appropriately sized at 3 to 5 millimeters. Okay, moving on, I'm going to begin with my finger tests. The way that I learned it, that I like to teach to help you remember it, is to go in the order of 3, 2, 1 with the eyes. That there are going to be 3 finger tests, 2 light tests, and 1 fundoscope or ophthalmoscope exam. Okay? So finger test, beginning with cranial nerve 2, the optic nerve. I'm going to test by confrontation, deficits in the visual field. So I want you to just look straight ahead at me, and when you see my fingers come around the sides, I just want you to tell me when you see them, okay?
No.
Okay, and I'm kind of forming like a globe around her head. Okay.
No.
Okay, good. And now to test cranial nerves 2 and 3, the optic and ocular motor, I'm going to do accommodation and convergence. I just want you to look straight ahead at me and follow my finger with your eyes. Okay, good. And I'm noting that her eyes constrict and converge appropriately, and when I come out that they diverge and dilate. And finally, for cranial nerves 3, 4, and 6, the ocular motor, the trochlear, and the abducens, I'm going to be checking her extraocular movements through the 6 cardinal fields of gaze. So I just want you to watch my finger and follow with your eyes. Okay, good. All right, and I'm noting that my patient is able to follow me and that no nystagmus is present. Okay, nystagmus is that sort of oscillating, like cat watching a tennis match that you'll see. And if there is nystagmus, it would only be a normal finding on one of the extreme lateral positions. We don't want to see nystagmus in a vertical position. That would be bad. Okay, so moving on with our light test, checking cranial nerve 2, I'm going to be looking for the corneal light reflex. I'm going to stand in front of my patient and just shine kind of on the side like that. And when I see that white pinpoint of light, I'm looking to see that that shines at the same spot or the same o'clock in both eyes. If I see it at 1 o'clock on the left eye, I should see it at 1 o'clock on the right eye. If it's not, that could be an indication that the patient has strabismus, also known as lazy eye. Okay, and for cranial nerves 2 and 3, I'm going to be checking pupillary light response, direct and consensual. So just look straight ahead at me. I'm seeing that's direct and consensual. Direct and consensual. Okay, great. At this point, I would want to state that my patient is PERLA and EOMI, and that stands for pupils are equal, round, responsive or reactive to light and accommodation, and that extraocular movements are intact. Okay. So finally, at the last portion of my eye exam, I'm going to grab my ophthalmoscope. So we'll work with you a little bit more on this when we come around, but basically I'm going to make sure that I'm turning it on. For myself, I'm going to have this focused on the 0 position. I know that, like with my eyesight, that's what works for me. And then you always just want to test it on your skin first and make sure that you're on the largest white dot setting. Okay? And the technique that we try to use with this is always to use your right eye to the patient's right eye, your left to the patient's left. Okay? And the reason for this is just that if I go in the opposite side, I'm going to get really close to her lips, and generally we don't want to kiss our patient on the first visit. Okay? So I'm going to be, it's okay just to place, I place a hand or a thumb on her forehead just to kind of guide you, okay? And I'm going to be coming in from the lateral side, focusing into the medial side, and I'm noticing her red light response, okay? As I look into the medial, I'm also going to be noting the optic disc. The optic disc should be a creamy white or yellow in color and have well demarcated borders. I'm also going to be noting 4 sets of retinal vessels. Okay. I'm seeing no papilledema and no AV nicking of those vessels. And as I look slightly to the lateral, I'm seeing the macula densa, which should be about 2 optic disc lengths lateral to the optic disc. Okay. And that completes the first part of our physical assessment.